Happy New Year, everyone. This is Dr. Teresa Dale, and you are listening to Natural Health Radio. You know you can find us on iHeart, Amazon Alexa, Spotify, iTunes, and Apple Podcasts. We are here to give you information that oftentimes cannot be found anywhere else. We are your health freedom newscast. So one of the most important things that I offer people is information on the physical, emotional body that is directly from 30 years of research or more. So we want to make sure you're getting accurate information you can count on to use yourself, heal yourself, and support your evolution so that you become independent. And that means that you are able to take care of minor things that come up on a day-to-day or month-to-month basis with your health, including things like structural pain, colds, flus, things like that you will know how to help yourself. And today's topic is about redesigning the biological computer. That is your entire endocrine system, repairing the entire endocrine system. Okay? But the biological computer is focused on the endocrine system. The endocrine system involves many hormones, even ones that you haven't even heard about. I mean, lots of hormones. So there are certain organs and glands involved with that, and we want to discuss things. When people think about hormones and the endocrine system, men and women both have issues with the endocrine system for a number of reasons. And we're going to discuss what breaks down the endocrine system and what can rev it up again, get it going, like a BMW or whatever, a Ferrari, whatever choice you want to make there is up to you. So one of the things that's so important is many people start getting panicky about their hormones because they're having insomnia, they're having hot flashes, mood swings, they're having so many different things that come up with their body. And all of those things coming up with your body is not an immediate thing. It's from years of doing things that possibly are not healthy for you. Or it could be some genetics. And the genetics can also be handled. So we need to look at some things related to options that people have. Okay, and women are no longer willing to accept the risk really associated with synthetic hormones. They don't want them. And oftentimes the health provider that they see doesn't give them options. So they end up sacrificing and settling because they think that there are no options. But women want safer alternatives. That's the truth. The negative side effects of traditional hormone replacement therapy is very well documented and includes cancer, gallstones, blood clots, high blood pressure, liver disease, and cataracts. Okay? So we know from the research that has been done both with the Women's Health Initiative and many, many other organizations that there's a lot of risk in taking hormones. But, you need to understand why. What happens to the body when you do it? And that is the thing that I think is very fascinating. Now, new research is continually emerging. An estimated 2 million women are now and have been using synthetic, natural, so-called natural plant-based and synthesized bioidentical hormones. Bioidentical hormones may originally come from, in their past life, may come from a natural source, but the fact that they're compounding, that process makes them a synthetic. So they're not really natural. And what you need to do is to understand here facts, like what do they do to the body? Why are they not good? Those are the questions that you deserve to have answered, and I'm going to do that. And because this is a big problem for the consumer, lack of education is something that can be rectified. You're sending this radio show to your friends. You're telling people about it, finding it on YouTube. You know, you just need to know that you need to know a good baseline on your hormone levels, and then from there a procedure can be started, a procedure that you can follow at home that will produce results using totally natural remedies. But as I promised, you want to know why. Well, it's very interesting because it's not a simple answer, but I'm going to make it simple. Your body has a circadian body clock, a circadian rhythm of how the body functions around the clock. Okay, think about a clock and think about that every hour or every couple of hours around the clock, different hormones in your body are automatically made and pushed out to be used. Okay? So it's very important that this body clock or circadian rhythm does not get confused as to its function. Okay? It knows, so your body knows when it's supposed to make hormones, a specific time of the day, and what times with different hormones are produced. That's on automatic. You don't want to stop that process or mess with that process, okay? Because then the circadian rhythm, the body gets confused and doesn't do what it's supposed to do. Now, when you are taking a hormone, whether it's plant-derived from the health food store and then compounded, or it's just plant-derived, synthetic or supposedly bioidentical hormones, no matter the kind of hormones you're taking, your body knows that it doesn't make those hormones. Therefore, it confuses, all of them confuse the circadian rhythm in the body. And the body starts shutting down because it realizes that it's getting hormones from somewhere. So it shuts down its own ability to make hormones. And after you've done this for a while, you've basically made your body into a vegetative state because the body is no longer making the hormones because you're pumping them in there. Now, you have to really understand that this is the truth, okay? And that is why you don't want to take hormones, because the hormones you're taking, they build up every day. Every day you take them, every day you use them, they keep building up, okay? And there is no process that just handles that because you keep putting it in your body. Whereas if your circadian rhythm is functioning properly, it makes all natural hormones in the right amount for your body. Okay? Now, when your body isn't functioning correctly because of stress or disease or you're not taking care of yourself, then the right amount of hormones that your body needs may not be produced from your body itself. And this can be fixed without using hormones. Most of your hormones have a very, very powerful relationship with your adrenal glands. They're involved in pretty much everything. So oftentimes with the stress, not taking care of yourself, having too much alcohol, caffeine, sugar, and all of that, actually is destructive for your entire biological computer, your endocrine computer, your endocrine system, your hormones, you see? So then your adrenal glands stop making the right amount of hormones, and your circadian rhythm isn't working right. So in order to fix that, all you need to do is change some things in your life. And we're going to discuss what those things are. But I want to tell you a little story first. A story about Mary. Mary had really great success the first month using natural homeopathic hormone rejuvenation system that I developed. But then she developed various new symptoms and thought they were related to her hormones or the homeopathic formulas. Her new symptoms included tremors, hot sweats, shaking, nausea, and vertigo. After speaking with Mary for about 25-30 minutes, the real cause was uncovered. The patient had a cracked tooth with a mercury filling in the tooth, along with many other amalgam fillings. And as I tested her body, I found out that this was the real problem and convinced her to go to the dentist to have it fixed, because the mercury leached into her body, and that mercury destroys, it really, really negatively affects the entire endocrine system, including the adrenal glands. It bypasses the blood-brain barrier, and it travels to the brain, affecting hypothalamus, pituitary, adrenals are affected, ovaries, if you have them, uterus, everything is affected along the way, including the pancreas, which is blood sugar and everything. So you need to understand that when you have hormonal symptoms, it doesn't necessarily mean that you need hormones. It means that something's causing that. And you need to be a good detective and look at the mind and the body and look in the dental area to see if you've had a new mercury filling. Have you had dental work? Do you have a new root canal? Do you have something that has been done dentally that can very much so affect the entire endocrine system? Because your teeth, each tooth has a meridian, acupuncture meridian running through it, and all meridians have an endocrine hormone connection, all of them, in some way or another. So we need to look at our teeth, we need to look at the health of our gums, we need to look at everything. Now, the mercury amalgam filling in Mary's case was 100%, I knew it. And as soon as she had that fixed, her shaking, nausea, vertigo, tremors stopped, okay? And that was it. Now, as soon as the tooth was fixed, the symptoms abated completely, and after 6 to 8 months later, after checking her, they did not return. So the fact is that hormones itself, your body's production of hormones, is greatly affected by heavy metal toxicity, right? No matter your age, doesn't matter your age. You could be 30 years old, 20 years old, 40, 50, 60, 70. You know, so this is a real story from a real client of mine. And, here's another one. I made a note of this. This is a very interesting story about June. June was a 59-year-old female. She had a complete hysterectomy and was using Premarin for 5 years. She had symptoms of hair loss, weight gain, hot flashes, depression, mood swing, and chronic fatigue. And I'm sure many of you listening have some of these. Okay? So listen up. Upon careful examination, of her 5-element saliva test and medical history, the test revealed she had adrenal burnout caused by the application of bioidentical progesterone and estradiol, HRT. Now, the HRT had suppressed her progesterone, making her estradiol elevated and causing estrogen dominance, and this can happen so many times. Okay. In addition, her testosterone and DHEA were very low. Her personal physician recommended Nuthem, hormone rejuvenation, to activate normal hormone production and detoxify the excess estrogen. So Nuthem is a homeopathic hormone rejuvenation product that will not make your estrogens so high that they become dominant. It will not do that. It cannot do that. But the 5-element saliva test also included an endocrine rebuilding diet that I wrote and a list of nutrients that are non-toxic nutrients that's helpful in maintaining normal hormonal balance. There's certain nutrients that you should take in order to have a normal hormone balance. Now, after 4 months, June, the patient did another saliva test, and the results indicated that all hormone levels were greatly improved, including the 6 cortisol adrenal testing times. You see, cortisol is produced by the adrenal glands. It's a hormone, okay? And we can see very clearly and accurately in a saliva test the levels of these 5 or 6 adrenal cortisol levels and make recommendations according to that homeopathic recommendations. June's adrenal glands were making the correct amount of hormones, and the after test 4 months later, more importantly, she felt much better with basically 95% of her symptoms completely gone, according to her doctor and me, looking at the test, and the doctor looking at I train health providers to do this work. Now, the patient was then given a maintenance program for another 3 months to use homeopathy effectively for hormone rejuvenation. Requires you stop and start the program according to how the patient feels. So you're not on it forever. You're on homeopathic hormone rejuvenation for usually 3, 4, 5 months maximum, and you stop it because you don't need it anymore, and then you get retested and see how you're doing. And in the future, should you have extra stress in your life from something that happens, and you feel like, okay, I'm starting to feel like I did before, maybe I had a hot flash, you can start it again on your own, easy. And then you would start it and do it for a week or less, and you would find that everything came back into balance because you're feeling better. So eventually this person, June, used the formulas only when severe stress was experienced, like I was saying. So this means that you're not addicted to anything at all. You're just using homeopathic hormone rejuvenation. You're using nutrients. Like, I make a product called Optimal Multi-Pro, and that has the 5-methyl tetrahydrofolate in it. It also has methylated B12, so it handles stress really well, and your adrenal glands and the brain function, memory function. And then it has in it phosphatidylserine and choline, which is so important for your liver and your brain, for the whole body. And it has all the B vitamins in it, and then an herb called ashwagandha, and it has curcumin, like turmeric. It has really phenomenal products, and biotin is one of them. Many times people, if they have a lot of mental stress and anxiety, and their diet is really, really bad, they can actually have a biotinase deficiency. Okay, and so then this formula, one formula has that in it. It's phenomenal, and I'm not saying that for any other reason that I created it to be phenomenal, because I want people to take less products, and rather than taking 10 different things, you're taking one thing, one pill, twice a day. So some people take 2 in the morning and 2 for lunch, but I don't ever recommend any more than that because you don't need it. They're in veggie tabs. They have no magnesium stearate, totally clean. So you really don't need to use hormones to balance the body on a regular basis, and in fact they will cause dependency and age the organs, because the organs are trying to do their job and you're stopping them from doing that because you're putting in the body all of these hormones, and your body cannot just wait until some of these high levels of estrogens and progesterones are just going to go away and the body's going to handle it. If you think that way, that's incorrect thinking, because it's false. It just builds up. So, for example, in a saliva test, I have seen progesterone levels as high as 50,000, and depending upon the woman, it shouldn't be any higher than 200. For a young woman who's in her 20s, it could be up to 300, 325, 350 for somebody in their 20s. You know what I'm saying? So, and then for someone in their 40s, it could be 125, but never, ever should it reach a toxic level, because that is affecting your entire body in a negative way. In other words, you have all of this toxicity of hormones in you. It's affecting your liver, your kidneys, your brain, your heart, your pancreas, your blood sugar, everything. So we want to make sure that you don't hurt yourself, thinking that you're doing something good. That is why my opinion would be that you need to take charge of things and become more educated about your body. Now, I'm going to give you some realities here. For example, diet and exercise have a great influence on hormone balance. Food that is negative for hormone balance is caffeine, because it dehydrates and exhausts the adrenal glands. This affects the adrenal glands from producing cortisol levels in the proper amounts, and also handling sugar. Sugar exhausts the adrenal glands, okay, as well as caffeine. Now, an endocrine rebuilding diet is a must, and for all hormonally challenged patients, you must do an endocrine rebuilding diet. Well, what is that? We're going to get to that. We're going to stop for a little break in just a couple of minutes, but I want to give you something else about the diet. A lot of chocolate is not good because chocolate has caffeine. Sodas that have caffeine in it are very, very bad for the endocrine system and the brain. Plus, they have a lot of chemicals in it. So you want to eliminate anything with caffeine and sodas. Okay, sodas, coffee, black tea, all of those kinds of things should be eliminated because it affects the adrenal glands. And we're going to take a little break because you're probably asking yourself, well, where can I find out more? So what you want to do is read some of the articles that I have on my website, wellnesscenter.net. That's wellnesscenter, CENTER.net. And then you can go to the media area. You can look at and hear, watch the videos, hear the media. Then you want to read some of the articles that I have about this. It's very, very interesting, and it will take you to a better place. Now, if you're interested in checking out the hormone rejuvenation, just go to Dr. Dale's Wellness Store That's www.drdaleswellnessstore.com. And then you can read more about them there as well. So if you need some help, we have help available every morning for anyone who wants to call. And that would be Pacific Standard Time, 9 o'clock in the morning to 1 o'clock in the afternoon. You can call 800-219-1261. If you become a member of the Wellness Optimization Club, then as a member, you can email me any questions that you like. You're a member of our private Health Freedom Healthcare Association. The cost is $20 a month, and it includes education, connection with me, protocols for helping yourself, lots of information that will help you in your educational process. So back to more realities, okay? So a lot of people are asking now, what other things can affect my hormones in a negative way? Root canals and other dental issues are actually a main disturbance of the body and can be the main cause of accelerated aging, and hormonal imbalances, okay? Root canals are dead teeth. Every one that I've ever worked with a patient where they had a root canal and I had them go to a dentist to check it out, they're all infected. Sometimes you don't see them on an x-ray, but if you have pain in it or a problem with it and you pull it out, you'll always see it's infected. And then they can send it to the lab to have a DNA test and find out what bacteria and viruses are there in the root canal that was pulled out. Okay? There's always viruses and bacteria related, and in the root, when it's pulled out, that's how we can test them. And look how I know what I'm telling you is true. It can be proven. Now, we also know that dental issues are a problem. Now, some of you may wonder about homeopathic medicine and how, if it can be effective or not effective and how that works. So one thing that's very important to share is that homeopathic remedies in general are not effective in a formula with natural or synthetic hormones, coloring, preservatives, flavoring, essential oils, fragrance, vitamins, minerals, herbs. In this case, the homeopathic remedy will be neutralized and will not work. In other words, homeopathic remedies, and you can use many of them in one formula like I do, so it has this broad spectrum approach, but a homeopathic remedy should only contain homeopathy, a little bit of organic alcohol to hold it stable. Okay? That's it. Water, the alcohol, homeopathic remedy. It should not contain anything else because it will render the homeopathic remedy to not work, to not work at all. It will render it in a way where it will be neutralized by the other things that are in the bottle with it, right? So it's homeopathic remedies, alcohol, a little bit of water. So we know that already we've discussed the diet and exercise is very important. But what kind of a diet? I would say that you need to eat and drink positive things. Green juices every single day. Get your greens in every single day. Okay? Get them in. 3 servings of greens or 2 huge smoothies that are stuffed full of kale, spinach, any kind of green veggie that's in there, zucchini, parsley, and then stick some dragon fruit in there. There's a frozen smoothie mix. It just got dragon fruit in it. There's no sugar in it. It's organic. You can find it in the health food store, and it's a berry. It's delicious. Just stick that in there, low in sugar, by the way. And then you could put some flax seeds in there, maybe very little, maybe a teaspoon. Put some maca in there. Put some turmeric in there. You can find turmeric, organic turmeric, in a bin at Costco. I was amazed. I saw this huge bin of organic turmeric at Costco. I think it was like $10. Okay, and I think it was like a quart or something. And I just use it every day in things. And turmeric is very healthy. So you want to put ginger in there. Ginger's really good for your body. Turmeric root in there would be better than turmeric powder. And then you could also stick an avocado in there. Of course, you want to open the avocado. I mean, I just being very specific here. You want to slice it open, get all the green part in there. It's a good fat. Stick that in there, okay? And you've had the most healthy meal that's totally absorbable for your body to use and all the nutrients in it, right? Even if you have digestive issues, that's what you need to do. So the next thing we need to talk about is biological age. Biological age is more important than chronological age when determining proper hormone ratios in patients' programs. So biological age means the health of your organs, like your liver, your brain, your pancreas, your spleen, your gallbladder. How healthy are your organs? You could have a chronological age of 70 and look very young because your biological age is like 40 because you're healthy and you've been eating healthy for years. And because your skin is the largest organ, really, of your body, depending upon the size, your weight and your height, your skin is the largest organ of your body. And the toxicity that cannot be handled by your liver, because your liver is so toxic, because of what you've been feeding your body, then the toxins can come out on your skin. And you can have acne, you can have psoriasis, you can have all kinds of things happen, right? So we have to know that your chronological age is not the important thing, it's your biological age. All hormone replacement, whether applied topically or taken orally, causes organs and glands to slow down or stop production of naturally occurring produced hormones. This causes aging. Okay, so all hormone replacement. So our hormone rejuvenation is not hormone replacement. It doesn't replace hormones. It re-educates the body to make its own hormones, no matter your age. It re-educates them, brings them to normal for your body, for your biological age. See, that's why I'm talking about both of these things together, right? So your biological age is crucial to your making the right amount of hormones for your body, okay? So that's why as you get older, in chronological age, sometimes, you'll see that, hey, I feel like I did when I was 30, or I don't have hot flashes, things like that, because you're doing everything that you can do in order to lower the biological age, keep it low, keep it young, keep your organs detoxified. An additional thing that I think is very important in the realities here is that the long-term use of HRT has been linked to breast cancer. Natural and so-called bioidentical hormone replacement therapy has side effects, and that's one of them. Remember we talked about every time you use hormones itself, it builds up body, and that's how you could become estrogen dominant and low in progesterone, or very, very high in progesterone. None of these things are healthy and normal. But by using homeopathic hormone rejuvenation, you actually re-educate the body to make its own hormones. And it will do that. You just need to remind it. And that is why you don't need homeopathic hormone rejuvenation for a long time, and why you'll never become addicted to it. So there is no randomized trial that has found a reduced risk of heart attacks or premature death or chest pain among women taking hormones. So we haven't found any good from it. There's no randomized trial that has found a reduced risk of heart attacks or premature death or chest pain among women taking hormones. That means there's nothing good here. HRT, hormone replacement therapy, may actually harm women with existing heart disease. Okay? So these are the things you need to know from research. Now, there's a certain amount of myths that we need to handle, okay? And here they are. Here's some myths for you. Hormone replacement protects against osteoporosis and heart disease. Totally false. Not true. Hormone replacement treats the cause of the problem. Totally a lie. Diet doesn't matter. There's another myth, another lie. Traditional synthetic HRT and natural bioidentical HRT does not have side effects. Totally a lie. And the reason I know it's a lie is you could see it in saliva testing. You could see it in some blood tests, but the saliva test is more accurate for testing hormones, so it's a no-brainer when you look at it. Anyone can see that a estrogen level of 35 when it should be no more than 3 is a problem. You know, the reference ranges are right there. So women, there's another myth, and that women with hysterectomies need HRT. Total myth. You need to balance your hormones, but we need to do it the other ways that we're discussing. Here's another myth. Wild jam cream, natural progesterone, phytoestrogens, DHEA, melatonin, and HGH, human growth hormone, are safe for consumption. Total lie. Totally not true. They are not safe for consumption, including melatonin. It fries your pineal gland. Don't take it. Fix the problem of insomnia so that your body produces and your pineal produces its own melatonin. Here's another myth. Very high levels of progesterone, as seen in blood and saliva testing, is non-toxic. Total myth. Another one. Natural hormone replacement is safe if monitored. Not true. The fact is that all hormone replacement will stop or slow down the ability of the body to produce its own hormones. All of hormone replacement. That is why I don't make it. That is why I don't recommend it. That is why I made the only homeopathic hormone rejuvenation in the world that is broad spectrum and FDA registered and tested with 20,000 people in before and after tests. We need to know that saliva is considered a better indicator of biologically active hormone levels than serum. It's more accurate. A saliva test is more accurate than any blood testing for hormones itself. Okay? So we look at the research that is available in the past, in the present. I put it all together for you. I've created formulas to help people. Now, saliva is also an accurate method of evaluating how HRT or topical hormone creams, sublingual drops, diet, herbal therapy, and exercise influence these levels. So when you have a saliva test done, you write down everything that you're doing in your life, what you're taking, all the hormones, and then we can see the outcome of what all of this stuff is doing to your body, right? And we don't do that to just to do that. We do that for the purpose of getting you on a program that if something is broken, we're going to fix it. If nothing is broken, we're going to tell you, hey, everything's fine and nothing's broken. But if something is not right, we want to tell you how to fix it naturally without creating more problems. Now, one of the interesting things is that cortisol is produced by the adrenal glands, and adrenal stress affects your adrenal gland and affects the cortisol production. So hormone imbalances can come from many things, like we talked about the dental issues. It can also be caused from scar tissue, because the scars actually block proper acupuncture meridian flow, because the scar itself is blocking that acupuncture meridian that's supposed to go through the scar, that meridian, but it's blocked because there's a scar there, you see? So it also, scar tissue can also affect the electromagnetic fields of the body, and electromagnetic field disturbances, cell phones, computers, can also affect our electromagnetic field. Pathogens can cause stress, environmental issues of toxicity of glyphosate and other pesticides and chemicals cause stress to our body. Emotions and belief systems cause stress to the body. Diet, bad diet, American diet can cause stress to the body. Medication, genetics, being treated improperly, taking meds that you don't need, or you're taking improper dosages of meds, all of this can create stress and imbalanced cortisol levels. So we know that all of these factors can cause significant adrenal stress and endocrine burnout. And one of the worst of them is taking any hormones at all, period. I don't care how much you're taking. It's going to be, maybe it's going to be okay for a few weeks or a month, and then you're going to have to go back and get another level of it because you're having symptoms. The problem is that you're taking it at all, okay, and that you're not doing the things you need to do to fix the body, to create healthy adrenal glands. That's the key to having balanced hormones, okay? So we want to stop for just a minute and do a little message from the California College of Natural Medicine. So if you'd like to become even more educated because of this show or because you wanted to do it anyway, but you don't know where to go to learn about natural medicine, go to the California College of Natural Medicine's website, www.cconm.com. Okay, California College of Natural Medicine.com, and learn about our clinical nutrition training or our homeopathic medical practitioner training or our naturopathic practitioner training. Learn about that and see if it's your dream to become a natural health provider, and then check out the trainings and give us a call and so that we can help you. So California College of Natural Medicine, we've been state licensed since 1995, and we have an online training and then some residential trainings as well. Now, one of the other things about cortisol levels and what affects it is our emotions. The prominent field of psychoneuroimmunology has researched the effects of emotional stress on the human body to find that stress is an important factor in immune-related issues. It affects your immune system. The marker used to measure success is the adrenal steroid hormone cortisol, so we've been talking about. Hormones are a powerful influence over all physical, intellectual, and emotional behavior. Prolonged exposure to stress may be devastating to the body and mind. My research indicates that the incidence of low cortisol levels is more common than high cortisol levels, although an extremely elevated cortisol level will then and can plunge to a low level hours or days possibly later. However, test results indicate that when 2 or more cortisol levels are elevated, when they're very high, and when they're elevated, there is a strong probability that the patient has diabetes or some genetic predisposition for it. So doing the saliva testing to check for cortisol levels is so important. You won't see this in blood testing, okay? If one cortisol level is elevated, it may indicate hypoglycemia, and this is treated effectively with diet and homeopathic formulas and nutrition. To the contrary, if HRT, hormone replacement therapy, is used in this situation, it will act just like any hormone and create further stress. It is a stressor. Using HRT is a stressor to our body and our adrenal glands. Think of the fact that when you administer insulin to a diabetic, the body then becomes dependent and lazy, eventually ceasing production of its own insulin. Think about this. The same thing can happen when you take hormone replacement therapy. You are taking hormones, the body becomes dependent, and the body becomes lazy, eventually stopping production of its own hormones. Insulin is one hormone, right? So we have to be very careful of using any HRT, and people use it for, of course, progesterone and estrogens and estradiol and estriol and testosterone and other types of hormones. So we have to be very careful of what we're doing. We know that emotions are key to get a hold of them and work with the process to detoxify them or neutralize them. We can do that by using homeopathic hormone rejuvenation and also the NeuroBalance Pro, which is great for a homeopathic remedy to help neurotransmitters balance out. We also need the neuroemotional remedies to balance the emotions. So we need to deal with all these different things homeopathically. You can check that out on our website. We have all that information for you. We also have a neuroemotional survey, a free survey test you can do on your own if you go to wellnesscenter.net. And if you look at under free self-tests there, you'll see the neuroemotional remedy. Take it. You'll understand what to do when you take it. Well, listen, I am so grateful to have you on the show listening today, and I want to know what you think. I want you to send me an email, become a member, go to our website, check everything out, and let's see how we can help you have the best, healthiest life possible. This is Dr. Teresa Dale signing off for today. This is Natural Health Radio. You can listen to this. You'll hear it live on radio stations, 30 different radio stations. You'll hear it live. And we appreciate your being here today. And we'll talk to you next week. Bye-bye for now.